Hi there. In this video, I'm going to explain about infectious mononucleosis, a virus that many of you may have had or should keep in mind the next time you kiss or share food with others. Infectious mononucleosis, also known as mono or kissing disease, is usually caused by Epstein-Barr virus, in short EBV. It is a member of the herpes family. It stays inactive for the rest of the host's life, and it can reactivate without any symptoms. Mono usually occurs mainly on teenagers and young adults, but anyone can get it at any age. Once you get the virus, it is unlikely to receive it again. Some of the signs and symptoms you may have is fatigue, fever, sore throat, headaches, body aches, rash, swollen lymph nodes on the armpits and or neck, swollen liver, spleen, and or tonsils. Here I have two images of swollen lymph nodes, one on the armpit and the other on the neck. In this image, it demonstrates a swollen liver, one on the CT scan and the other on the outside. If the person were to have a swollen liver, it can also occur hepatitis, an inflammation of the mid-liver, or jaundice, yellowing of the skin, and the white in your eye. In this image, it shows a swollen spleen that can cause abdominal pain. And here we have a swollen tonsil that can cause reddening, swelling, and white patches. Some of the causes of mono are Epstein-Barr virus, direct contact with saliva from an affected person such as coughing, kissing, sharing foods or drinks, body fluids such as blood, sexual contact, or organ transplants. The doctor will check for the patient's temperature, and they will also check for any enlargement of the spleen glands in the neck, armpits, and groin. A monospot test will be performed to check for antibodies such as heterophile antibodies. An EBV antibody test will be performed if the monospot test is negative. It will also look for EBV specific antibodies, and a white blood cell count will be performed in order to check for elevated number of white blood cells or abnormal lymphocytes. There are ways to prevent mono by not sharing your drinks, food, or personal items such as your toothbrush or utensils, by drinking lots of fluid, resting, taking over-the-counter medications for pain and fever, and avoid contact sports. You can recover with no long-term problems. Fatigue may continue for a few months, and if the patient is severe, then they must continue to see a physician. Now I'm going to show you a video of someone who had mono.
My name is Allie. I'm 23 years old. 10 months ago, I was diagnosed with mono. I tested positive for the Epstein-Barr virus. I just got really sick. I had a sore throat. I had fever all the time. It broke out in a rash on my neck. I couldn't get rid of it. I had some nasty sores that nothing helped. I finally got to the point where I couldn't even get out of bed. I had no appetite. It's hard for me to concentrate. I was losing weight. The doctors had tried several steroid therapies that none of which worked. They told me I would be sick for the rest of my life. They told me I was going to go to chronic fatigue syndrome and, I'd never get my energy back and all this stuff. And I was just like, no, that's not right. I'm 23. I still have things that I want to do in my life. And somehow I managed to drag myself out of bed and go to a job interview. That's how I met my current boss, who he was familiar with Twyla and her wellness clinic. I told her all of my symptoms, my problems. After the second and third treatment, both my rash and my sores were gone. That hadn't happened in months, so that made me happy. I could tell it was doing something positive. Probably about the fourth treatment, I noticed that I was feeling more close to normal than I ever had felt in months. I could actually get out of bed. I noticed I had an appetite. My skin started clearing up. I could actually go to work during the day and do something productive. I sleep better, eat better, gain my weight back. I actually have the energy to work out and live healthy lifestyle now. And I'm also testing negative for Epstein-Barr virus, finally. Yay. I would recommend this treatment to anybody. I'd especially recommend it to people who have viruses who don't respond to steroid treatments or anything else that typical doctors want to do. Granted, those things are great and sometimes they may help. Now I'm back to normal and I feel actually better now than I did before I got sick. It's been great.
Here are just a few references I used for my project. In conclusion, mono is caused after Epstein-Barr virus, usually transmitted through saliva. Mainly teenagers and young adults get this virus. You can get swollen organs such as the liver, spleen, tonsil, or you can also get swollen lymph nodes on the neck and or armpits. If you are not taking precautions for this virus and have quote unquote active life, then it's best to go check with your primary doctor. Stay safe and thank you for watching.